Dr. Alexander Scott, good afternoon. So with all these numbers going in a good direction, the hospitalizations are down, the spread, the percentage down. So what is the end goal? At what point is the Department of Health going to say we're at X percentage for infection rate, and then we can begin to see whatever normal is to get back? What are we looking at over the next weeks and months for metrics to say, okay, now things are going to be at the right number?
Yeah, the high-level view is understanding that the variant taking effect would have increased predominance and could potentially cause spikes in cases and subsequently hospitalizations. We continue to monitor for the hospitalizations, Mark, because making sure that our healthcare system is able to maintain the capacity needed is key. We want to ensure that what we currently have will be able to account for what is potential with the variant. We really hope that with what we have in place now in terms of restrictions, continuing to tread cautiously and giving time for our accelerated vaccination rate to continue, that we would not have to go significantly longer with the type of restrictions in place. We want to make it so that when we do start the reopening process, there is little chance we would have to turn back. So we need to understand where the variant is. We're monitoring with genomic surveillance. We're monitoring with our outbreak numbers, getting a sense of the predominance, and also giving time for getting enough vaccinations out so that our models will show our healthcare capacity is continuing to, would be able to withstand what would occur.
Just one follow, with the low spread in schools, the vaccination with teachers, at what point do you anticipate the kids are going to be able to ditch the masks?
There's still time for that. We know the masks are a very necessary and effective tool in decreasing spread. But certainly as we go through our summertime and begin plans for the fall, we will likely have across the board a number of reassessments about where we are with herd immunity and what changes in our society we can achieve together to be able to go forward through the rest of the year once enough individuals are vaccinated and we have control over the variants that are in place. So it's not off the table, but for right now, we want to make sure that masking continues because it is very effective, but we'll certainly be exploring what's possible come fall.
Just to be clear, you mentioned the schedule of the next eligibility group, 60 to 64-year-olds and those 16 and over with underlying conditions is still on track for the middle of the month. Is that correct?
Yes.
Do you think you'll be able to do teachers at the same time?
Yes, that's...
What allows you to do that when that wasn't the plan before?
Yeah, there are a combination of items that are there. We've certainly proven in terms of our ability to increase the administration. As I shared before, we shrunk our overall timing as we are shifting from phase 1 to phase 2. We have fewer partners that we need to distribute to. That allows our inventory to shrink and for us to get more vaccines out into the community. We also have been working very closely with the pharmacy partnership, where the federal government had required us to allocate a significant number of our vaccines to. And as they are administering, we are being very aggressive with pulling back whatever has not been administered so that we can have that additional pool. And then lastly, with Biden's announcement, we're working continually at a national level to ensure that they are continuing to push additional vaccines out to us so that we can all accomplish this effectively.
You don't expect the sign-up system to get swamped when that happens. I know in Massachusetts they're already booked a week out and they're supposed to start teachers next week. Are you seeing availability right now? Is there some room in the system?
Well, we'll be working with the governor, obviously, and the partners who are out there, as well as with Commissioner, to determine the best plan so that we roll this out in a way that will be effective, allows for our state-run and larger mass volume sites to continue with the focus on the eligibility groups that are there, while also ensuring that our educators begin a vaccination process that might be a little bit more refined for what they need.
Just on the homebound, I know you mentioned the Johnson & Johnson. There's still a lot of concern. I know that you've mentioned the sign-up list for people who want the vaccine who are homebound, but what is the plan to actually get it to them? We're still hearing a lot of concern that they're not actually getting the vaccine.
Yeah, that has been an important community for us to focus on. We have been working with vendors who are going to be able to reach out to the individuals and access them directly who are homebound. So having that list has been important to build to make sure that we are capturing those who we don't already have information on. We've appreciated the work that our municipalities have done with helping to engage, and we'll be pulling in those additional vendors who can actually go to the homes and ensure that. That's also a focus for this month.
Education Commissioner Fonte-Green. In Massachusetts, Governor Baker has said April 1st he wants the children back in school. Cranston today announced school committee that soon K through 12 have the K through 8, I believe, have the option of in-person. Where do you stand with what is it going to take, or what is the deadline to get children back in the classroom?
Well, we want the kids back in the classroom tomorrow.
But it's not going to happen tomorrow.
Right. So one of the things that we're doing is working very closely with the superintendents as well as with the municipalities to see where we're going to go very quickly in the next 2 or 3 weeks to get teachers vaccinated and make sure that we have a very steady plan. As you know, we've been planning step by step alongside the superintendents. So I think that we will see where we are. Part of our limitations, to be totally honest, is the CDC guidance in terms of busing, in terms of how many kids can be in the classroom. We hear that that's going to change. So that becomes a little more difficult for certain districts that don't have the space.
So you don't want to give a deadline of April 1st the way Massachusetts is?
Well, I don't think we can do that right now.
They're doing it.
Well,
they're the #1 school system in the country.
Well, they have handled the pandemic a little differently, so I would say that we've done a better job with the schooling than Massachusetts has. So,
Even though they're going to be back in.
So let me clarify something. We have 208 schools in person, fully in person. So let's get the numbers. That's more in proportion than Massachusetts. We have 99 of them hybrid, which means that they're sharing the space because they don't have the space. We only have 4 schools that are virtual, 4 that are fully virtual. So I think it's really important for us to understand where we are. We have the majority of our kids are in person. So I think that we will continue to work because what we want is all the kids in person all the time. So we're going to continue to do that. They can put that deadline, but remember, they have not been in school all year. They have not in Massachusetts.
In just regards to the Providence contract, if this were a 9-inning baseball game, in your mind, where are we in that game? Because it's coming up on 2 years. Where there was the Wall Street Journal Education Horror Show Nightmare. At the end of last year, you said, if we don't see action, I'm going to take drastic action. Where are we with that contract?
We're in the 9th inning. We're in the 9th inning, yeah, and we've been negotiating for over like 300 hours. So we're at the tail end of that.
Bill, next question.
Doctor, what impact of vaccine on the serology test? And then is there a number you're looking for in that serology test that may impact business reopening decisions?
Yeah, it'll be helpful to see what we learn from that, knowing how far we have come since the first iteration of the serology testing. We've been working and very much appreciating our testing and validation task force experts who have continued to keep us abreast of what's out there in terms of the serology testing capabilities and how it can inform our policy making. Right now, it's still too early to tell whether or not there would be any dramatic shifts, but similar to before, we'll hopefully be one of few states that will actually have this data to help us understand, is there something differently we can do with vaccinations? Will it help inform how we can support businesses as we go forward? We're looking forward to seeing what information we gain.
The last go around sort of showed that everybody who said, hey, I had COVID or I think I had COVID in the wintertime probably didn't. Is there any reason to think that that may have changed, where we've had a lot of asymptomatic people not tested that probably had the viruses, or anything indicating that going in?
Yes, it's very possible. And true to how this pandemic has been educational overall, it will be interesting to see what we gain, knowing the increase in asymptomatic prevalence that has occurred and knowing the variant that's in place now.
Question in the front, and then Alexa after that. Secretary Pryor, you mentioned restaurants, the changes are tomorrow. The other three groups you didn't give a timeline for. Could you fill us in?
Yes. All of the changes are effective tomorrow, with the exception of the catered event changes that I referred to. It's our expectation that we'll be able to grow to 100 indoors, 150 outdoors, and that will be able to include those changes to dancing rules as pertains to safe conditions for such activity. That still needs to be formalized and put forward in the way of guidance. We likely will be able to do that by mid-month, the governor's demarcation point of March 14th, and we're in dialogue with those industry groups. But the other changes are in effect tomorrow. I also note, while I'm on the subject, if I may, I realize on the issue of fitness and gym establishments, Governor McKee and we have received inquiries from martial arts studios and other fitness establishments that involve contact between participants. We are creating a set of rules by which those activities may resume, and we'll have more to say about that in detail for those that are interested.
Alexa, and then Pat after that.
Secretary Pryor, the curfew on bars is still hurting a lot of restaurants. They have to reserve tables for their bar seats so that they can move over once 11 happens. When are we going to get rid of this curfew? Why do we still have it?
The question was about bars. Thank you for asking it. We have not yet revisited those rules. I will note that our neighboring states still have rules that keep bars closed. So in Massachusetts and Connecticut, you will not find bars open. We've created rules in close consultation with the Department of Health that enable, although restricted activity, bars to be opening for seatings. So we're grateful that we are operating at that level. We will continue to revisit all rules under the governor's guidance.
And then just one question for Dr. Alexander Scott. I'm hearing reports that people aren't able to fill their prescriptions right away. They're going to retail pharmacies, and these pharmacists are telling them that they don't have time to fill their prescription right now because they're so busy with vaccines, and to come back the next day. Are you hearing reports, and how can you mitigate that?
No, I have not heard that as of yet, but appreciate learning of this, and as always, we'll bring that back and help address it as well.
We'll go Pat, and then Amanda after that.
Commissioner Infante Green, regarding RICAST, clearly this is a difficult time for standardized testing. Missed classroom time will minimize the availability of teach to the test prep that is typical of most school districts. Logistical issues, timing, physical space, COVID distancing, impediments to testing, and clearly scores will be artificially impacted by the classroom disruptions typical of the COVID era. My question, states like Colorado and Ohio are debating legislation that would suspend standardized testing, simultaneously approaching the federal government for a waiver. The Biden administration has signaled a level of receptiveness to this provided data, as long as that provided data is collected about the impact of COVID generically. Is Rhode Island contemplating this, given the real question about the validity of teaching gains or losses based on all of the above?
Sure. So the Biden administration put out a letter, and we applied for the accountability waiver. They have not given a waiver on testing. That is not the case. So a couple of things so that we are clear. The assessment is actually more important now than ever because we do need to know where the kids are. Everybody's talking about learning loss, gaps. We don't know what that is. We actually need to be able to measure that and measure it for each student. And it allows us to continue to advocate for the needs of our kids. We've been conducting our advanced accreditation and advanced placement for our students task force. and we call it LEAP, which is Learning Equity Advancement Pathway, which the governor helped launch, where we're looking at individual students. Where are we going to focus? Where are we going to move forward? And we need the data to do that. We're pretty clear on that. Everyone that we have brought into our sessions, which are open to YouTube for everyone to participate, has made it very clear that the data is going to drive where the needs are. I know that with our preliminary data that we saw, so one of the things we did with our stimulus money was get interim assessments. The places that we have seen the biggest impact is in the earlier grades, which stands to reason if you think about kids learning to read and all the things that need to happen. So we need to focus our energy, but what we're not going to have is the accountability piece. The piece where we say, oh, you need to improve in this area. No, we're looking at the kids, what we need, and where we should be focusing our attention and our resources. So two very different things. With the accountability off the table, we all know that COVID has had an impact on all of us. We know that. We just need to know how much. Is it a 2-year gap? Is it a 3-year gap? What is it? So.
And then Anita after that.
My question is on restaurants. So for either of you, restaurant owners are really hoping to have that 100% capacity soon. Do you have sort of a timeline on when you can ease restrictions on restaurants? They're really wanting 100% capacity with 6 feet of distancing. I guess what made you choose 66% as a number?
Our focus is to take incremental steps as we go. We certainly wanted to, in support of the governor, show that there could be some steps that we continue to take carefully. We want to also have the time to assess what's happening with the variant. As more cases have been identified, we've started to see an increase in cases, really get an understanding of what direction that is going in. And then also take the time over the next few days to be able to put together a full package that we can present to businesses that allow for an incremental over a long-term reopening that people are familiar with up front. That's going to be new about how we present it going forward. So we want to take the time we need to really prepare that and bring it back.
Last question from Anita.
Can I just follow up? With a question on vaccinations. When people are going to these state sites, they're wondering, can they choose what vaccine they get? Will people be able to do that, or sort of they get what they get?
No, the goal will be that the information will be available, so they'll be informed about which vaccines are available, knowing that we now have 3 very effective vaccines for achieving the goal we've had in place, of keeping people out of the hospital and keeping people alive.
I have 2 questions. Secretary Pryor, you spoke about catered events and the restrictions loosening soon. One of the restrictions is requiring that guests get a negative test prior to the event, which is a big ask, and I'm hearing that that's very troublesome for those. Are there plans to increase it? I think it's 15 now, or eliminate that once the vaccine is more widespread?
We're in dialogue about all of the conditions that we've instituted to enable safe reopening. I'll say this, though. New York has likewise instituted a testing requirement for their catered events. So it's a trend in our region. I'll also say that the ability to reopen with confidence relies upon having certain safety precautions in place. And if you think about a catered event, an event like a wedding where many of the people at the event are very familiar with each other. They are in fact family, they are close friends, almost by definition. Those are really social gatherings in a formal setting, and those are places where infection can occur if we're not careful together, which is why we've worked very, very closely with industry groups to establish the precautions that will enable us to reopen with a degree of acceleration here, but not to be one of the places on the planet where we see outbreaks. So having said all of that, we will continue to evaluate all the preconditions, including testing, as we go forward.
Governor, you spoke about vaccine hesitancy yesterday, your executive order. The church has come out and said that there are moral concerns about the Johnson & Johnson vaccine. I don't know where Rhode Island stands, we haven't heard back yet as far as our bishop, but are you concerned that it's going to push people away from using that vaccine? There's already people who are telling us they don't want the Johnson & Johnson vaccine because of its effectiveness. Are you worried about this?
Yeah, so the Johnson & Johnson vaccine saves lives and keeps people out of the hospital. That is an absolute. And that's what people need to know. So if they're looking to save their lives and get out and not go in the hospital, they should be taking the vaccine.
Are you worried about vaccine hesitancy, though, now that
Oh,
the
yeah.
church has...
We are definitely concerned about that, and that's where we spent yesterday visiting churches, visiting businesses, visiting sites. And I see this as an all-in, right? It's an all-in. We need to have all our municipal leaders, civic leaders, church leaders, along with our state leaders, Department of Health. This is an all-in, because I've been saying this for weeks. There's going to be a point in time when we have more vaccine than we have people willing to take the shots. We got to get 70 to 75% of the people vaccinated in the state of Rhode Island to make sure that we're reopening in a way for our schools and our businesses. So it saves lives and it keeps people out of the hospital. That's the most important message that people need to hear.
Are you talking to the diocese at all?
Please?
Are you talking to the diocese about this?
We'll talk to anybody that can be helpful to us. And I'm not sure exactly what you're talking about there, but we'll definitely follow up because it saves lives and it keeps people out of the hospital. It's proven to be that case. So anybody who's like pushing back because it is not effective, they really are not working on the science that we know is true to be true.
Back on its development and not its effectiveness, the way that it was developed on potentially aborted fetuses. NPR did a whole piece on it yesterday.
People can make up their minds in terms of where they are religiously. It saves lives and it keeps people on the hospital. That's our job to make sure that happens.
Governor, a couple of questions about small business, which you had a big focus on as Lieutenant Governor. Is there any money left from the original tranche of money? And going forward, what's your vision? You've got big stimulus coming in. I'm wondering what you're thinking. The businesses have been waiting for you to become governor. What's your message to them now?
Yeah, so we're going to put out several millions of dollars in grants that were carryovers. That'll be announced when we announce the budget, which is coming up very quickly. And we're going to continue to create incremental, advancement in terms of our business footprints as we have today. But the goal is to beat this variant down over the next couple of weeks. It's very important that we follow the protocols to the nth degree so that when we actually enter in the back half of March, we're starting to open up our businesses. And then the other piece there, get the PPP loans, right? And then we're going to be working on regulation to make sure that Rhode Island continues to improve as a small business friendly state. Thank you.